So today's a special day because I get to talk about my surgery experience and being the patient, so I put myself in your guys' shoes. I had a lower blepharoplasty with fat repositioning, and I also had a fat transfer to the face, nano fat under the eyes, and I also did microneedling. I've always had under eye bags. I feel just genetically I had those little puffy bags. I look back on pictures that it's always something that has bothered me, and I feel like just as I've been getting a little bit older, they become more noticeable, and the darkness, I just always looked really tired, and I just wanted to look more refreshed and less tired. I think trust is everything when you're picking a surgeon. You're trusting them not only to take care of you during surgery with your life, but also to make sure that your goals and your outcomes align and that you're going to come out looking exactly how you're expecting. I would say that he is very knowledgeable. He's like an encyclopedia. You can ask him anything and he'll be able to provide the answer for you. And he's also very compassionate and caring. So he's gonna call you the night of surgery right after you're out of the OR to make sure that you're okay. And he's gonna check on you frequently after as well. For my pre-op, Dr. Gould came in and he assessed the areas that we're going to be doing surgery. I had also added a breast scar revision where I had a previous lift from. That was something that really bothered me. It didn't heal well. I typically don't scar well to begin with, so I asked him if he would be able to improve the scar. He said, definitely, we can do that while you're under. So we came in for pre-op, he assessed the area, he walked me through the whole process of what he's gonna do, like the surgical technique that he's gonna do. He talked to me about the different techniques for the lower blepharoplasty. We reviewed any questions that I had. On the day of surgery, I was able to come in with my boyfriend and we got pre-oped with Nurse Brittany, who I've actually worked with before at Ivy Surgical Center, and I felt just really comfortable, especially because I know all of the team there. Dr. Gould came in and he also just kind of recapped what we were going to be doing that day. Then Anthony came in, we did a little bit of filming, and I was ready to go back. When I went back into the operating room, I felt really comfortable. Dr. Galindo was there, the anesthesiologist. He's one of the anesthesiologists that we frequently use for our surgery cases. I have 100% faith in him and Dr. Gould, so I really wasn't very nervous going into surgery, and I didn't really have that many questions because I kind of just trusted the whole process. I've seen all of our patients go through it before. I see how well our patients are taken care of, not only by doctor, by the surgical team, by the anesthesiologist, so I felt really safe, comfortable, and the next thing I knew, I woke up. I was in the recovery room. I felt a little bit of discomfort in the breast, but that was kind of it. And I felt pretty awake, surprisingly. I knew everything that was going on, and I was ready to go home. So first day waking up, I felt a little bit of spiciness in the breast, a little bit of burning sensation, but that was pretty much it. I would say the under eyes were a little bit tender, just like when I was washing my face. It just felt soft, tender to touch. There was bruising, swelling, obviously, but not really anything uncomfortable. I did take Journavx, which is the non-opioid pain medication that we do prescribe, and I felt that was all I really needed. Some days it was a little bit difficult for me to sleep because my eyes were pretty dry and irritated. I would say that was probably the most discomfort that I had. So watching TV wasn't really an option for me. I kind of just would lay there and listen to the TV, or I would listen to a podcast on my phone. But not really any pain, just more uncomfortableness. I think at day 5, I came into the office and I had my stitches removed. Day 6, I was back at work. But I think it took about 2 weeks for that major swelling to finally subside. That is a good point because I have had many patients question why I had surgery. They say, oh, you're so young. Why did you have surgery? You didn't need anything. And I was like, it's something that bothered me when I looked in the mirror, when I took photos, or I felt like I would have to filter my photos to try to edit out my under eyes. Or if I was wearing a really low cut top and my scar was visible, it's something that really bothered me. So I would say age isn't something that determines when you should have surgery. I think it's when you're mentally ready. If you feel like you have there's also the support system at home to help be there for you, because I feel nobody is exempt from kind of going through those highs and lows of surgery. You could be so prepared, but you can still even have those low points. So I would just say being mentally ready, having a support system, and really knowing and being educated on what procedure you're doing. I love my results. I was just talking to Dr. Gould earlier. He said I still had some swelling that I personally don't notice. I feel like I look 100% healed. I do notice that my under eyes keep getting better. So initially at first, because of the bruising, they looked a little bit darker, but as time goes on, they're just lightening up on their own. Yes, so I think going through surgery yourself, you learn to be more patient and more empathetic, because I do this every single day, and even though I know exactly what to expect, I still had a point where I was like, oh my god, I look crazy. Was it the right decision to have surgery? And I think giving patients a little bit more grace when they're going through that, and also just kind of holding their hand and letting them know everything is going to be okay, helped me put that into perspective. I'd say it's very normal to be nervous, and I would say just ask a lot of questions. You know, our team here is to support you through everything, so we can answer anything for you. But I would say that you are in the best of hands.